Shall I start?
Yes, sir.
You have to see the same things. So, good evening, everyone. This is Dr. Abhijeet, and welcome to yet another session of this Oracle 90 Days Foundational Life class for university exams. The next topic and the last one, which I will be discussing for this particular session, it is the prostaglandins and the related compounds. So obviously, I will be discussing this entire topic in the form of the Q&A format, that is the question and the answer format. These questions have been taken keeping in view the previous 10 years papers of the various university across all over India, right? I will be revising the entire topic in a very crisp, concise, and conceptual manner. So the ones appearing for the university prof exam, obviously they can benefit from this particular session. Even the ones who are going to appear for the national exams like INI-CET or the NEET PG exam, they can also benefit from this particular session, right? So yes, the questions that I will be discussing, that is the synthesis functions and the significance of prostaglandins. Again, a 10 marks question. I will be discussing it in detail. The short questions will be on the COX enzymes, the COX 1 and 2, that is the cyclic oxygenase, right? The cyclooxygenase 1 and 2, right? I will be discussing about the leukotrienes, the functions and the significance of leukotrienes. Also the thromboxans, which you have already read in physiology, but I will be covering a little bit of over here also, right? So yes, we have 10 marks, we have 8 marks question, 5 marks question, or the short answer which can ask in 3 or 2 marks question, right? Now, guys, we have the recorded classes in the Oracle app for the flexible learning. Like if you just if you are not attending the classes live, you can always go on for the recorded versions which are available on the app for each and every particular subject, every particular topic. Otherwise, we are conducting the live classes daily from 6 p.m. to 10 p.m., right? We have the practical sessions, guys, 1 month before the exam or just before the exam. You want us to go through the practicals. Obviously, each and every practical is demonstrated. What you have to write in the practical exams, everything is being discussed in these practical sessions video, which is available on the app, recorded, available on the app. Apart from that, 1 month before the exam, 20 days before the exams, coming to me, students asking me, sir, how to revise? We can't go on for the textbooks. So you can revise the entire subject in just 20 hours. In these 20 hours, we have covered the high yield points, guys. We have covered the high yield important points. And over here, we have this hard copy book set, which is now available at your doorstep, right? We have curated this hard copy book set in the form of Q&A, all the topics in the form of points, fun zones are there, riddles are there, MCQs are there, how to write the answers, the schematic line diagrams are being covered over here, right? Foundational classes, guys, we have already told you these are the classes, these are the live classes, which we have already, discussed. They are available on the app. The ones who are not attending the classes live can always go on for these foundational classes, right? We have the live classes which are scheduled daily from 6 p.m. to 10 p.m., right, on the app as well as on the YouTube channel also. We have the express exam module. We are covering the entire topic under 20 hours, right? Under 20 hours, right? We are teaching how to write the answer in the exam paper, right? Which points we have to cover while writing the answer, right? Everything, the schematic line diagrams and everything are being covered over here. Apart from that, there is one-to-one doubt clearing session. Always you can go on for these. If you have doubts in any particular subject, not only biochemistry, you can always schedule a prior appointment with the management and you can fix a time where you can ask your doubts with the educator, right? And we have the hard copies book set, which are now available at your doorstep. You can order it from anywhere, any part of the India, and it will be available at your doorstep. And these are the ones which I will now ask you to prefer while writing the answers in your exam papers. Now, we have the question bank, guys, covering the questions from basic to advanced level, right? So we have one-liners, we have clinical vignettes also nowadays, the hot favorite of the examiner, that is the clinical vignettes. The expert team has also curated, keeping in view the new question, the new pattern of the exam, whether it is FMGE, NEET, PG, or INICET. Questions are being curated. Also, the questions are being covered from various university across all over India. So we have reduced the burden of you people, for searching questions from different university exams. So everything is like curated and put it at one place over here. You can always go on for these questions, right, which are given like topic by topic. After every topic it is given, and just try to test your knowledge while after completing each videos, right? And the practical sessions which are being recorded, I have already told you regarding this, and the subscription plan. So we have the basic foundational plan, right? We have the advanced learning plan for 6 months. We have the complete learning plan for 12 months, and we have the ultimate MBBS plan for 4 years, right? For additional discounts, guys, you can use my code Dr. Abhijeet 20, right? Now, coming on to the very first question, discuss the biosynthesis, functions, and clinical significance of, yes, prostaglandins. Now, guys, remember, answer number one. Now, first is the biosynthesis of prostaglandins. Now, whenever I say prostaglandins, guys, remember these are the lipid compounds. They are made up of lipids, right? So they are lipid compounds, and which lipid actually it is the polyunsaturated fatty acid, and which polyunsaturated fatty acid it is the arachidonic acid, right? It is a polyunsaturated fatty acid, right? This arachidonic acid, it is basically present in the phospholipid membrane, right? It is present in the phospholipids. So it is present in the phospholipids of cell membrane. Phospholipids of cell membrane, right? So yes, firstly, what are the biosynthesis steps? Firstly, you have to remember the release of So firstly, we have the release of arachidonic acid. Arachidonic acid. So basically, you already know the arachidonic acid. It is basically released from. So let us assume this is the membrane phospholipid, and from membrane phospholipids, basically there is release of arachidonic acid. Arachidonic acid. Okay, and with the help of enzyme, yes, phospholipase A2. Phospholipase A2, right? So it can be released no in response to like various stimulus or any injury, guys. If there is any injury, right, these membrane phospholipids, by the action of an enzyme called as phospholipase A2, the arachidonic acid will be released, or even if there are any hormones, right? Now we have the second one, that is the cyclooxygenase enzyme. Cyclooxygenase enzymes, right? Now, what happens? This arachidonic acid, it is basically converted into, remember, it is prostaglandin H2 by the help of cyclooxygenase enzyme. Cyclooxygenase enzyme, these are also called as the COX enzymes. Now, these COX basically they come in two forms, that is COX1 and COX2. Right? So COX1 cyclooxygenase 1, basically it is found in most tissues of the body, right? Most tissues of the body. Now, this COX1 is responsible for producing prostaglandins. So it produces prostaglandins, which are involved in normal physiological process. normal physiological process, right? COX-2, basically, it is kind of an inducible enzyme. Inducible enzyme. So, see, physiological, it is the one which is occurring normally in the body. Now, when I say COX-2, basically, it is an inducible enzyme. It only gets activated. It only gets activated in response to if there is any inflammation in the body. Inflammation, injury, right? Okay, so it will no be responsible for the production of prostaglandins, which are involved in inflammation or any injury of the body, right? Now, what will happen to this prostaglandin H2 after the action of the cyclooxygenase enzyme? This prostaglandin H2, so prostaglandin H2, it is converted to specific prostaglandins. So we have prostaglandin E2, we have prostaglandin D2, prostaglandin F2 alpha. We have prostacyclin. We also have thromboxane A2. So basically, the conversion of prostaglandin H2 into different prostaglandins, whether it is E2, D2, F2 alpha, prostacyclin, or thromboxane, basically they are no regulated by the tissue specific enzymes such as the prostaglandin E synthase. Now, synthase is basically the class of enzyme which helps in the synthesis, right? We also have prostacyclin synthase. So these enzymes will act and automatically it will be no giving up these prostaglandins. We have prostacyclin synthase, or we have thromboxane synthase, right? So yes, that is something you all have to remember. So this is how the prostaglandins are synthesized. So the first part of the question, the biosynthesis of the prostaglandins. Now coming on to the functions of the prostaglandins. Next is, yes, the functions of prostaglandins. Firstly, we have already discussed that is the inflammation. 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 So for inflammation, we have prostaglandin E2 and we have prostaglandin. Yes. Now we also have this prostacyclin, guys, right? Prostacyclin, right? So yes, so basically the I2 and the E2, they are the key mediators of inflammation. Key mediators of inflammation, right? So yes. Now, what do these do? Actually, they remember very important, they promote vasodilation. They will help in the dilation of the blood vessels. Vasodilation. They increase vascular permeability. They increase the vascular permeability, right? So, yes. And obviously, if we are talking about inflammation, which enzyme it is? Actually, the COX-2 one, which is no particularly important in inflammation. Secondly, guys, remember we have the common, that is the pain and fever, right? Remember, guys, prostaglandin E2, right? It sensitizes the pain in the body. It sensitizes pain, and you already know the pain receptors from the physiology. It is the nociceptors, right? The nociceptors which are contributing to the pain perception, right? Especially during the inflammation process, right? Even guys, if we talk about the fever, so basically they act on hypothalamus. It act on hypothalamus, And obviously it will act on hypothalamus to increase body temperature pyrexia. Body temperature, that is pyrexia. Okay, contributing to the fever during infections or any kind of inflammation, right? Now, they also help in regulation. The fourth one, that is the regulation of blood flow. Now, PGI2, that is the prostacyclin. Prostacyclin, basically, it inhibits platelet aggregation. It does not allow platelet to aggregate, and it also causes vasodilation. It causes vasodilation. Now, obviously, it is inhibiting the platelet aggregation. It is causing vasodilation. It is playing a very protective role, okay, in the blood flow, right, and the heart in this, right. Again, we have another one, that is thromboxane A2. It is thromboxone A2. It causes platelet aggregation. It causes platelet aggregation, right? The PGI2, the prostacyclin, causes vasodilation. It will cause vasoconstriction. Vasoconstriction, right? And obviously, if it is causing platelet aggregation, it is helping in clot formation during any injury, right? During any injury, right? Now, remember we have more functions, right? Even in the reproductive one, if you want to remember, that is the prostaglandins, that is PGF2 alpha. It is involved in uterine contraction. Very, very important. It is involved in uterine contraction. Okay, and that is the process that is taking place during the labor and menstruation. The normal menses that a female experience, right? So basically, it also contribute to ovulation, no fertilization by no contracting the smooth muscles of the reproductive tract, right? So these are the various functions of the prostaglandins. So that was the next part of the question, that is the functions of the prostaglandins. And what is the clinical significance, guys? Obviously, yes. The third one, that is the clinical significance of prostaglandins. Now, firstly, you already know the non-steroidal anti-inflammatory drugs. Okay. For example, you already have used aspirin, or you have used a drug called as ibuprofen. 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 Now, what does they do? They basically inhibit the COX enzymes. So if they inhibit the COX enzyme, they are automatically reducing the synthesis of prostaglandins. So if the prostaglandin synthesis is reduced, automatically there will be less pain, less inflammation, less fever. And this is like important in conditions like rheumatoid arthritis, okay, or dysmenorrhea, that is painful menstruation, or there can be osteoarthritis in cases of fever, right? Another, it is the cardiovascular disease. The cardiovascular diseases, right? So basically the thromboxane A2 and PGI2, that is the prostacyclin and thromboxane. Basically, yes. If we talk about the aspirin inhibitly will no irreversibly will inhibit COX-1 enzyme. So it inhibit the COX-1 enzyme, right? So yes. So what automatically it will do, it will reduce the production of thromboxane A2 will be decreased. right? So decreasing the thromboxane A2 is decreased, obviously, so the blood clot formation will be decreased, right? So which is useful in conditions such as heart attacks, and even strokes, right? PGI2, on the other hand, can increase the risk of bleeding, right? So yes, excessive inhibition of these prostaglandins should be avoided. Otherwise, it can increase the risk of bleeding, even the kidney damage, right? So that is again one or two functions that you can remember for these prostaglandins. So that was regarding the biosynthesis functions and the clinical significance of prostaglandins. Coming on to the next one, that is the note on cyclooxygenase enzyme and their role in prostaglandin synthesis. So basically we have COX-1 and COX-2. We have already discussed this in detail, that is cyclooxygenase 1 and cyclooxygenase 2, right? So obviously we have already discussed that the arachidonic acid release arachidonic acid released. Basically, it is from the phospholipids, right, of the cell membrane by the enzyme phospholipase A2. Now, once arachidonic acid is released, what will happen? Right, it is metabolized by the COX enzymes, right? It is metabolized by the COX enzymes to PGH2. This arachidonic acid will be converting into PGH2, the prostaglandin H2, right? This is a common precursor for the synthesis of various prostaglandins. PGE2, PGF2 alpha, right? We have already discussed this, right? So yes, prostaglandin E2, basically it is by prostaglandin synthase, right? Prostacyclin PGI2, that is prostaglandin, prostacyclin synthase thromboxane A2, right? So that is something you have to remember, right? COX-1 beta, remember always that it's an housekeeping enzyme. It is active all the time, just like your mother, right? The homemakers or the housewives, they are active all the time. So it is also a housekeeping enzyme. So this housekeeping enzyme basically helps in maintaining the homeostasis of the body. Homeostasis of the body. Okay. So now remember what are the functions of this COX-1? COX-1 derived PGE2, right? The prostaglandin E2 and PGI2 basically help a very important role in this, what we say, the gastrointestinal tract. They are helping in promoting mucus and bicarbonate, HCO3 minus secretion, help in blood flow, and they also help in the prevention of formation of ulcers. Okay, that is something important. Apart from that, COX-1 can also know it is important for the non-selective, no, this non-steroidal anti-inflammatory drugs, right? Like we discussed aspirin or ibuprofen. It reduces the prostaglandin productions, right? So that is again you can remember. They also help in regulating the renal blood flow. Renal blood flow. Okay, the GFR, try to maintain the GFR, right? Now, COX-1 is also responsible for the production of thromboxane A2 in platelets, right? Now, it will promote what? Platelet aggregation and vasoconstriction, which is very, very important for blood clotting. Important for blood clotting. COX-2, basically, I have already told you it's an inducible expression. Inducible expression, right? So, yes, it is always no activated in response to any inflammation in the body. If there is any injury in the body, right? So yes, obviously it's a mediator of pain or fever, right? So yes, we have already discussed this, right? In the previous question. Now, coming on to the next one, discuss the functions and clinical relevance of leukotrienes. Now, the third question. Now you already know, guys, the leukotrienes, remember from L to L, it is basically the lipid mediators. And again, they are also derived from, arachidonic acid. Arachidonic acid, okay? They are released from cell membrane phospholipids by phospholipase A2. Okay, again, we have another pathway, right? The biosynthesis. You already know we have, yes, the lipooxygenase pathway. So yes, you can just read it from the book. It is again the same pathway, right? The lipooxygenase pathway. So arachidonic acid, basically it is metabolized by the lipooxygenase enzyme, and basically it is the 5 lipooxygenase, and it is converted into leukotrienes, right? So yes, now this leukotrienes, the very important function, it is involved in the inflammation. Now, how it is now involved in the inflammation? It is important in chemotaxis. Now, what is chemotaxis? It is movement of neutrophils to site of injury or any infection in the body. If there is any infection, the neutrophils, that is the component of the white blood cells, will be attracted towards that injury, and that too will be taken care by the leukotrienes, right? So it will actually increase the neutrophil adhesion, okay, the sticking of the neutrophil, okay, to the endothelium, okay, which will help in the migration into tissues, okay, so it will help in the inflammatory response, right? It also helps in bronchoconstriction, right? We have like cis LTs, or we have like much more, right? They help in no bronchoconstriction. If we talk about the clinical relevance, it is basically in the case of asthma, right? Or any other allergic no or respiratory disorders, right? So basically what these leukotrienes do, this leukotrienes basically it causes the smooth muscles contraction. It causes the smooth muscle contraction. Okay. And what it will do, there will be narrowed airways. And obviously, if the airways are narrow, it will result in difficulty breathing. Thirdly, they are also involved in allergic reactions. Right? So yes, for example, the runny nose, guys, that is called as rhinitis. Or if there is any food allergy, or if there is any anaphylaxis, right? So yes, there is smooth muscle contraction in responses to allergens, right? So that is something you have to remember. So asthma, rhinitis, right? These are all the clinical relevance now in which they take part. Question number 4. Explain the role of thromboxanes in, yes, platelet aggregation and now homeostasis. You should know that thromboxanes are basically a class of eicosanoids. And these eicosanoids, basically, they are derived from arachidonic acid. So basically, they help a very, play a very crucial role in platelet aggregation and homeostasis, right? So yes, you already know how thromboxane A2 is formed, right? We have arachidonic acid released from the phospholipid membrane, right? Membrane phospholipids, arachidonic acid is released from, on this arachidonic acid, the cyclooxygenase enzymes will act. They will convert into prostaglandin H2, and this H2 will be converted. It's a precursor. It will be getting converted into thromboxane A2. Now, this thromboxane A2, it is basically helping in platelet aggregation. We have already discussed this. Platelet aggregation. Now remember guys, whenever the blood vessels are injured, if there is an injury to the blood vessels, right, platelets will be adhered to expose to the subendothelial matrix, right, and become activated. Okay, so basically they will be releasing certain pro-aggregatory factors like adenosine diphosphate or serotonin. Now, what this thromboxane A2 will do, it will help in binding of platelets to each other, right? So basically, they bind to each other by the activation of certain receptors. These are actually called as the glycoprotein receptors, which is 2B and 3A receptors, which are present on the platelets, right? Platelet surface, yes, and which then like bind with fibrinogen. This helps in the aggregation of the platelet, which is a crucial step now in forming a mesh kind of a network, right? So this thromboxane A2 also helps in vasoconstriction, okay, which means the narrowing of blood vessels at the site of injury. Now, this vasoconstriction, what it will do, it will try to reduce the blood flow to the injured area. So it will decrease the bleeding, thereby it will be contributing to the hemostasis, right? The process of stopping the bleeding, it will try to constrict the blood vessels, right? So it is basically the vasoconstriction is taking place in small arterioles. Very, very important. It is taking place in small arterioles and capillaries, right? So it can reduce the loss of blood during the early stages of injury, right? So that is you have to remember. Name the precursor molecule for prostaglandin synthesis. Again, discussed many of the times, right, guys? It's a one-word question, and it is nothing but the arachidonic acid. Arachidonic acid, right? So it is released from the membrane phospholipids by the help of enzyme, yes, phospholipase A2. Phospholipase A2, right? Then it is metabolized by the COX enzymes into prostaglandins, right? We have already discussed this. Now, prostaglandin I2 basically helps in maintaining the hemostasis. Firstly, it helps in vasodilation, very, very important. Vasodilation. Vasodilation means widening of blood vessels. Widening of blood vessels, which helps to maintain the normal blood pressure. It helps to improve the blood flow, right? So, yes. Secondly, it inhibits platelet aggregation in the blood. It inhibits the platelet aggregation in the blood. Okay, so it inhibits the platelet aggregation, therefore inhibiting the blood clot, reducing the formation of blood clot, right? So that is something. It also helps in the regulation of vascular tone, right? So it helps to maintain the balance between vasoconstriction and vasodilation, right? So yeah, the blood pressure is maintained accordingly, right? The next question, that is the inhibitors of COX enzyme. We have aspirin and we have ibuprofen. We have already discussed this in the starting. Aspirin is also called as acetyl salicylic acid. Salicylic acid. So this aspirin, it is, yes, irreversibly, irreversibly inhibits COX-1 and COX-2 enzyme, right? By acylating a serine residue in the active site. So which actually reduces the synthesis of prostaglandins, even the thromboxanes, right? So it is used for no anti-inflammatory purposes. Anti-inflammatory purposes help to reduce the pain, that is analgesic effect, help to reduce the pain also. Even to lower down the body temperature, it is helping in antipyretic effect. Pyrexia means fever, antipyretic means to reduce the body temperature, right? So ibuprofen will inhibit both COX-1 and COX-2, right? So yes, it is used for all these purposes, the anti-inflammatory, analgesic, and antipyretic effects, right? So that is regarding the two inhibitors of COX enzyme. So that was regarding the prostaglandins, so very short kind of a topic. So just you have to just go on through the synthesis functions and clinical significance. And yes, thank you for your patience and listening me out. These are the various social media handles which you can follow for the update of upcoming classes. Thank you.